It's been stated earlier, related to the opioid addiction crisis that we're not doing enough, and I wholeheartedly agree with that. In my area, we are serviced by the Armstrong, Indiana Clarion Drug and Alcohol Task Force, and they are doing some great things to reduce these addiction deaths right now. And I think that's great, obviously, but again, I think we need to do more. But my question pertains to the decrease in treatment facilities. In the governor's budget book, it reflects a decrease of 291 to 262 residential facilities and from 739 to 730 non-residential programs at a time when we're all saying we need to do more. So can you explain that to me and how that is helping us solve this crisis?
Thank you. I can address this issue in a couple of different ways. First of all, we have made some changes in our regulations and our licensing language to really consolidate some programs for simplicity of the providers. So where in the past a provider may have had two separate licenses to basically do the same kinds of things, we've begun to allow some more flexibility. We talk about flex beds and other things. So rather than providers having to have multiple licenses, we've been able to bring some of those things together. So while those numbers appear to tell a pretty negative story, the overall number of facilities being licensed in Pennsylvania has actually gone up, and it is really those licensing counts that look at somewhat differently.
So I see there's not a reduction in treatment facilities or programs, but it's more of a consolidation.
I mean, every year we have a few that close and a few more that open, but overall our numbers of licensed facilities have been on the rise.
Okay, so getting back to the Armstrong, Indiana Clarion Drug and Alcohol Task Force, they really are making some great strides. Benchmark strides, in my opinion. We even had CNN out to do a story on them recently. And their big concern is we're talking about the elimination of the carve-out, and I know that's a heated subject, but it really, and from my feedback with them, they are very much concerned that all of their efforts are going to be lost if we lose this carve-out, which basically gives them funding to do their own thing, more or less, and they are setting the standard. So my questions, first of all, your view on the carve-out, and secondly, why, if we have organizations like this that really are making a difference, why aren't we benchmarking, looking at best practices and emulating those services across the Commonwealth?
Yeah, great questions. So I'm actually going to address them in reverse order, though. Okay. So kudos to Armstrong, Indiana Clarion, because truly they are one of our single county authorities that we very regularly highlight. They are often at the cutting edge of thinking of innovative ideas. In fact, they have a pilot program from us using some federal funding to pilot the Bridge device, which is a newly FDA-approved device to help bridge individuals from active addiction onto medication-assisted treatment using Vivitrol. And so part of the funding that they will be utilizing includes doing an evaluation study so that we can, in fact, determine what are the outcomes and how can we replicate that in other parts of the state. So we do often do those types of things, look at where there are positive outcomes and how we can emulate those things in different places all across the state. And thanks to Armstrong, Indiana Clarion for being one of the leaders in many cases for those issues. So related to the behavioral health carve-out, I think it's really important to know that the administration hasn't made any determinations about the future of that carve-out. And in fact, I think no one knows better than probably myself, Secretary Miller, and Secretary Levine, that there are positives and negatives to virtually everything in the healthcare world. And what we do know is that the carve-out has allowed many counties to stand up some really, really innovative and successful programs over the years. What we also know is that stigma does still exist around substance use disorder and mental health. And so while a vision of a fully integrated healthcare system is a really good vision, and it's shared by all of the Health and Human Service secretaries, so if everybody believed the way we believed, I think it would be a great idea. What I think is concerning is that not everybody in Pennsylvania does share that belief. And so there is some concern about what it would mean to change the structure of that payment mechanism currently, knowing that it has been utilized to stand up some really successful programs. With that said, I think there are some really valid arguments about how fee-for-service models have created some challenges for integrated care. So I think it's important that we try to address the problems without necessarily making carve-in, carve-out the only solution to what those problems are.
Okay, thank you. I would just encourage you to keep up the good work and make sure we're doing the right thing for those who suffer from addiction. So thank you.